Hello, I'm Dr. Dan Fischer, practicing dentist and CEO of Ultradent Products, Inc. I'm sending you this message from the Rocky Mountains to your gorgeous paradise, your little emerald down in the Caribbean. Certainly, we have opportunities in this, the now, and in the near future. Problems usually equate to opportunities. So I'll share with you some of my concepts, my ideas, starting from our history, moving through where opportunities are to help those we serve in many ways. I've been asked to speak relative to how Ultradent became a company. I've been asked to speak on what I see as the needs of patients, the future of dentistry, and I've been asked to speak on humanitarian and what Ultradent does in that regard. On the first subject, dentistry became my passion as a young dentist in dental school through the 70s. Full mouth reconstruction was the epitome of dentistry for me. I felt if I could prepare 28 teeth in a day, and within 1-2 weeks I meant 28 crowns, I'd arrived. I had a need for making quality impressions. Impression making is the most critical aspect for quality prosthesis, be it of crowns, bridges, veneers, you name it. I came to learn that the tissue management materials of the era were not adequate. So having been taught IV sedation at dental school, I knew access to veins. I started drawing my blood each night after working on patients and working with different chemistries. And out of that process, the astringent and the dental infuser were born. Now, our intent was not to start a dental company. Our intent was simply to get these materials available to other dentists. When I approached large companies, however, they weren't interested, or certainly weren't interested in paying for the value that I was offering them. So on that note, we came to realize that if these technologies were to get to dentists, we'd have to do it as a family. Ultradent was built with family. And it was mass mail-out, stuffing envelopes, getting samples across America initially that got us known. The first product was made on the kitchen table. We did have to learn quickly to meet FDA standards. But from that humble beginning came a technology which is still one of our greatest contributions, namely facilitating ways that dentists can achieve quality tissue management, the control of bleeding, the control of soft tissues rapidly and predictably. As I was continuing to practice in my early years and moving back to Utah here in the Rocky Mountains, I came to discover that not many humans had the money for full mouth reconstruction. I learned that I needed to listen more to the patient. I learned I needed to meet more their needs. Fortuitously, in the late 80s, the early 90s, adhesives came into being of high caliber. I learned that I could, in fact, facilitate minimal invasive dentistry, that I could provide aesthetic results, and at a much more affordable price. And I also found that my tissue management experience became paramount if I was to reach more socioeconomic groups who had challenging pre-existing conditions, who may even had teeth that were mutilated but couldn't afford the expensive indirect. That to be able to control the tissues, control bleeding prior to using high-strength adhesives, it was invaluable. And I discovered that tissue management was 10 times more important for the adhesive direct place restoration than even for impression making. For the moderate and the longer term future, we've got to find a cure for caries. Caries is a barbaric disease. It's goofy that at the 21st century, we are scooping out rotten lesions that are caused by bacterial infection and plugging holes. It's not that different. The technologies of the materials are different, but the concept is basically the same as what it's been over the last couple hundred years. We've got to get in front of this process. And certainly with people living longer, With us boomers going into our 80s, 90s in the near future, and some of us beyond 100 years of age, we've got to rethink how we treat those we serve. I believe it's paramount that we push off more invasive procedures, the full crown, the veneer, not using these more invasive procedures, if at all possible, on our fellow Americans in their 20s, 30s, and 40s, but rather pushing that back in time to their 60s, 70s, and 80s. Remembering that the more we cut tooth, the more we weaken tooth, and the more times we cut on the tooth, the sooner we kill the tooth. Trauma to tooth is additive. With people living longer, with us boomers not being satisfied with dentures, it's going to be paramount we rethink for younger Americans not being as invasive. I think it's important we remember that the weak link on the indirect restorations, it's the cement margins, it's the luting resin margins. How do those look on crowns and veneers at 10, 20, 30 years out? And are we comfortable continuing to replace these expensive indirects? Even if the patient can afford it, are we comfortable continually replacing, knowing that each time we replace, we add to the incidence of the tooth losing vitality? For many good reasons, and especially now with our downturned economy, we must be more serious on getting more affordable dentistry to a larger segment of our fellow Americans. In our humanitarian efforts, we've come to learn that the Western diets have been exported to the rest of the world. Our Western dentists have not been exported to the rest of the world, and they couldn't afford them if they had. I've come to realize that most probably the single most common source of severe pain to humans of low socioeconomic status is the abscessed tooth. This is a tragedy. It's severe.